Welcome to this episode of the Disease Du Jour podcast on the topic of thoughts on equine acupuncture with Dr. Anne-Marie Allman, owner of Del Dios Veterinary Acupuncture. I'm your host, Kim Brown, publisher of Equine Management. The Disease Du Jour podcast is brought to you in 2022 by Merck Animal Health. Allman, DVM, CVA, CVCH established Del Dios Veterinary Acupuncture to focus on healing patients through traditional Chinese veterinary medicine by providing acupuncture and Chinese herbal medicine to equine and canine patients. Dr. Allman attained her DVM from the Western University of Health Sciences College of Veterinary Medicine in Southern California. During veterinary school, she attended the Chi Institute near Ocala, Florida, where she studied traditional Chinese veterinary medicine and became a certified veterinary acupuncturist. Dr. Allman then became a certified veterinary Chinese herbalist through the Chi Institute and continues to advance her education in that specialty. She serves on the board of the American Academy of Veterinary Acupuncturists. Welcome to the podcast, Dr. Allman.
Thank you so much for having me. Happy to be here.
Well, we're really happy to have you here because we know that horse owners are becoming much more familiar with the benefits of acupuncture, so they ask their veterinarians about services. And conversely, veterinarians have learned a lot more about different ways acupuncture can help horses. But since not all veterinarians know when to refer a patient to a certified acupuncturist, we wanted to have you come on and help us a little bit this morning. So let's just start with some basics of what sort of, and again, this is for our veterinary audience, what equine physical or behavioral issues respond well to acupuncture?
So probably one of the go-to things that acupuncture can be useful for in a referral setting is any sort of pain management. Probably the most typical cases that people think of when they want to add to their arsenal, they're already working up a case, they already got multimodal pain management going on, but they have a horse that still needs help. Laminitis was the perfect example for this, that, you already have, so many different ways to help make these laminitic horses more comfortable. And acupuncture can be really the cherry on top to help get those animals over the threshold and back into a healing state. So, and pain management in acupuncture is probably the mainstay of the evidence-based medicine approach to evaluating acupuncture. There has been a lot of research in human medicine about pain management and acupuncture. There's actually a lot of research in nausea in human medicine. And so there are times when you have those either gastritis horses or kind of, hindgut dysbiosis horses, where these horses aren't clinically sick necessarily, but they're just not doing well and their digestive tract is kind of operating suboptimally, where acupuncture can be really helpful. There are certainly, anytime you have more of a chronic disease state where the animal is waxing and waning and just not getting to where you need them to go, acupuncture can be a great tool in the toolbox. What I tell my clients, and the conversation with the referring veterinarians runs a little different, but what I tell my clients is that, if I get hit by a bus, give me all the morphine and take me to the emergency room where I'm going to get surgery to fix my broken bones. However, if I have more of a chronic disease or an internal medicine condition, then I'm going to reach more for acupuncture to help my body heal itself. And so there's certainly plenty of cases where acupuncture is not indicated as the first, tool that you reach for. In those like emergency trauma, it just cut its hoof off cases. Yes, acupuncture can help in those cases, but honestly, conventional medicine is going to address those so much better than acupuncture is. But conversely, acupuncture is a huge powerhouse for pain management and for managing internal medicine conditions and really helping the body get into a parasympathetic healing space.
It's such good advice just to think about it as a tool in the toolbox. It's not necessarily the first thing you reach for, but sometimes it's great. And when you were talking about internal, I used to live in Kentucky, and it amazed me some of the ways that some of the certified acupuncturists were using it, especially with all those broodmares in the area for reproduction. for some of those types of issues. And then got to know some of the acupuncturists and using this for behavioral issues. So things that maybe you never could quite get to the bottom of physically. And so let's talk about those just a little bit. Some of these other things that you may not just think about at first shot when you have a client that's got a patient that you're maybe scratching your head a little over.
Yeah, I mean, we all know that these behavior cases can be really challenging because it can be difficult to parse out how much is the human component, whether it's the owner or the trainer or, whatever is going on the human side, and then how much is either a pain response from the horse, either like a physical pain, the musculoskeletal pain, or some sort of visceral, stomach ulcer type behavior, or or something that's more like a neuropathy, like the trigeminal neuritis. Like some of these behavioral things, it can be really difficult to parse out how much of this is physical, because some of it you can't just block out, and do your diagnostic analgesia and be like, okay, that's it. So one of the powerhouses of acupuncture is actually the diagnostic scan. That, for me, when I'm working with a referral veterinarian, and they've already done all of their due diligence, they've done all the testing, it's negative for this, that, and the other thing that are their top differentials, and they're really scratching their head. When you do the acupuncture scan, I would say it can be really helpful in directing further diagnostics, because if that horse is sensitive for all the acupuncture points associated with the front feet, right, yeah, then maybe we let's look at, what's going on there, first when they thought maybe it was a head shaking thing, right? So or its body feels great, but it's on fire for acupuncture points that are associated with the stomach. If they haven't done a gastroscopy, that's the perfect time to do it, right? Because what I tell people is that, all of your conventional diagnostics are still the gold standard for working up this horse. When you bring in acupuncture, it's just another lens. It's another piece of information that can help direct all of our conventional diagnostic tools.
What about some things maybe that acupuncture is not useful for?
So we talked about trauma cases, really great for healing after the trauma, after the bleeding has been taken care of. I think the issue with acupuncture is that, unlike a pharmaceutical medication, it doesn't work the same on each individual. And so, the problem with it is that you can't say, well, I just put these 10 points in these 15 horses and I'm going to get the same response each time. And this makes the most sense to riders, right? Because you have some horses that are super light on the aids, right? You just think canter and you're in the upward transition, right? And you have other horses that take so much seat and so much leg and so much spur and so much crop, and oh my gosh, are we ever going to get there? And there's really a close correlation with how sensitive their nervous systems are. And so, those really heavy on the aids horses require so much more stimulation to get the healing in acupuncture. Some of my favorite horses to work on are those thin skin red thoroughbred mares, right? Because if you get 3 needles on that horse, that's a great day. Everybody goes home happy. It might be a little bit of a delicate dance to get those needles in, but they respond beautifully to acupuncture because they're already so primed. Just think how hot they are, right? They're already so primed to respond. And so, conversely, that big, heavy set, roly-poly, warm blood, that heavy on the aids, kind of drafty type, they require a lot more treatments or different treatment strategies, to get the same effect. So I would say that's kind of a big caveat about acupuncture. And what you alluded to earlier about, unfortunately, acupuncture is very similar to chiropractic and massage, where it is highly practitioner dependent. If you like, we can talk about how to pick one, because that can be challenging.
Today's Disease du Jour podcast is brought to you by Merck Animal Health, the maker of prestige vaccines, Banamine, Panacur, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their unconditional investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program and the partnership with Equitrace, which delivers secure, streamlined record keeping and instantaneous temperature measurement when coupled with Merck Animal Health Biotherm microchips. Visit MerckAnimalHealthUSA.com for more information. Well, that was really my next question is, how can a veterinarian, a referring vet, find a certified equine acupuncturist that they can trust with their clients and patients?
These are my personal opinions, but we'll start with the objective information. So what you really want is someone who has gone through one of the 3 courses available to become a certified veterinary acupuncturist, or a CVA. And so these courses have gone through the American Association of the Veterinary State Boards Registry of Approved Continuing Education, the RACE approval required to become certified acupuncture courses. And they're all about 6 month to a year courses. They're all about 200 hours of education. They all require written exams, clinical exams, case reports, and internships. And so, compared to, say, becoming boarded in, ophthalmology, it's a shorter course, but it's still they are good programs. And so, I went to the Chi Institute for my initial certification. There's also IVIS, which is the International Veterinary Acupuncture Society, which offers courses, and then Medical Acupuncture for Veterinarians, or CuraCore. And those are the 3 top certification programs. And so picking a veterinarian that has completed those certifications is important, because you can actually attend those courses and not complete your certification. And so that's something to consider as well, is that they need to have done the internships, which are usually like 30 hours or more. And they need to have done the reports in order to have completed their certification. That being said, it's just like anything else, right? If you are referring to a surgeon for colic surgery, do you want to refer to the surgeon that's cutting 1 a month? Or do you want to refer to the surgeon that's cutting 3 a day? So the same thing with acupuncture, it really, like you were saying, in sport horses, acupuncture's been around, really popular since the 70s. And as we get more into the clean sport and more drug restrictions, we're seeing alternative medicine practices become more and more popular in horses. And so that's great, because what you're also finding is there's more availability of veterinary acupuncturists. CVA is what you're looking for when you're finding a referring veterinarian. But my personal soapbox about acupuncture in veterinary practice is that I would want to refer to an acupuncturist who has regular clinical experience in the field that they're practicing in. Because when they're coming out to see the horse, I don't want them to just be focusing on acupuncture. Either I want someone, if they're coming out for a horse for a reproductive concern, I want someone who has reproductive experience in horses. And so my background is in sports medicine, right? And for me, I can't tell you how many times I've done an exam on a horse for acupuncture, and you find the things that you find when you do a physical exam. You find that, bowed tendon, you find the, abscess that's brewing, you find the things that are kind of considered more general practice things. So you're still primarily a veterinarian, right? And so that's kind of when I talk with young students who are all geeked out about acupuncture, I tell them, okay, go to one of the CVA courses, but I also want you to go into general practice first. I think that's super important. Whether it's an internship or mentorship after, vet school, getting that clinical experience and learning how to do a really good physical exam is the best way to do no harm. And so acupuncture is the specialty that comes after, right? But you really need to have I believe, have a good sense of general practice first.
Those are really great points and some great advice for younger veterinarians. So how do you recommend that the referring vets, I know we sort of covered this, but maybe take a case where how would a referring vet get in touch with you? And I know you're licensed to practice in California, Michigan, and Florida. So let's say that somebody, a sport horse in Florida, and it's when you're down there, or Michigan, or whatever it is, and they want to find you, they want to talk to you. How do they get in touch with you to say, is this a case where I should use acupuncture, or I've had good experience in the past with acupuncture? What do you usually find, and how do these referring vets work with you?
In general, if you're searching for a veterinary acupuncturist, these three certifying bodies, the Chi Institute, IVIS, and MAV, they all have their own search engines, where their veterinarians are registered, where you can look up someone in your state, in your area that has training there. You can also go on to aava.org, and that's the American Academy of Veterinary Acupuncture. And the AAVA has a fellowship program, and they're working with the AVMA House of Delegates to try to get acupuncture to be a board certified specialty. And so they have a list of veterinarians that doesn't matter which course they go to. And so you can search for them that way. In less, formal ways, one of the things that Kimberly and I were talking about before we started recording was that equine practice is becoming more collaborative and less competitive. And this is a beautiful thing. And so, if someone is unsure if acupuncture could help or not, text them, call them, meet them for coffee. We're also busy, but that doesn't mean that you can't develop a new relationship with a friend. And what's great about acupuncture as a specialty is that I don't do general practice, right? So I'm giving the patient right back. It's the same as if you have an internist come in and consult, right? And so I share reports with the owner and the trainer and the primary care vet and anybody else, in the local referral hospital and anybody else that wants to see that information. And so I think that, nowadays, one of the best pieces of advice I got as a student was from a surgeon up in Calgary. And he told me, Anne-Marie, don't be afraid to reach out to the top and ask them for advice, because 10 times out of 10, they would be happy to help you. So don't be afraid to reach out to whoever it is, even if they seem intimidating or you haven't met them or you don't know who they are. Veterinarians are pretty cool people, and they usually are interested in helping each other out.
And that is really great advice. Dr. Allman, is there anything else that you can think of when you're talking about trying to just use more acupuncture on the cases that need it for horses?
Historically, veterinarians have been pretty protective of their cases, but I think that with this switch to collaboration, the referring veterinary acupuncturist, should be fairly easy to work with. And so on those cases, there shouldn't be any reason not to use acupuncture earlier for diagnostic help, and then often for help in treatment. And so what's great is that, you're seeing at horse shows, there's almost always multiple people doing acupuncture in the FEI tent because you're at the horse show and these horses need all the help they can get in a stressful environment. What's great about acupuncture is hopefully the practitioner will use their discretion. So if there's certainly been times when people have asked me to come do acupuncture, and I'll say, yeah, I'm happy to come and see the horse. And I do my exam and my evaluation, and then we decide, there's another modality that actually might be better than acupuncture. But that doesn't mean that acupuncture still can't be a really useful diagnostic tool. And so I would say that for the veterinarian who's not interested in doing acupuncture themselves, but is interested in using a referring veterinary acupuncturist, keep that in mind, that it's not even necessarily the treatment, but the diagnostics that can be helpful for your practice.
That's a really great point. And I know some of my other friends who are certified really believe in that. So thank you very much, Dr. Allman. I've learned a lot today, and I'm sure our audience has too. And hopefully, I love let's be more collaborative let's work together for the good of not just the horses, but for the humans involved. So thank you for joining us on this episode of Disease du Jour. And thanks to our audience for listening. And a special thanks to our sponsor in 2022, Merck Animal Health. We invite you to listen to episodes of Disease du Jour on any podcast network, iTunes, SoundCloud, Stitcher, wherever you like. Or you can also go to equimanagement.com, and all the podcasts are there on a SoundCloud player. You can just read the article that goes along with them and get some information. And if you have any questions or suggestions for topics, you can send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com. Disease du Jour is a production of the Equine Podcast Network, an entity of the Equine Network, LLC.